want to teach you not to draw on bodies.
Okay, Janet, I'm not very good in drawing, but I have to draw on you.
Okay.
So what's the reason for drawing? Well, we need to make sure that the area that you look at is the same area that we take care of it when you lie down, because they completely look different. Now, this is something that you do for yourself, so we want to make sure that we take good care about this area so you'll be satisfied. So that's why we take a little bit more extra care defining or drawing the area that we have to work on. So you mentioned that you wanted the upper abdomen. The lower abdomen fits perfectly fine. So this is the area that we're going to be working on from under the ribs, or what we call the subcostal area, and all around the upper part above the belly button or the umbilicus, and that's the upper abdomen. So this is the area that we want to get smaller or flatter, and the drawing just helps the operator or the doctor to make sure that he does not miss the area exactly that we want it to get smaller. The other area that we want is the hips. So this is the area that we're going to be working on right here and right there. And the third area that we want is the back. So I'm going to ask you to turn to the back all the way. Good. And this is the area that we don't like, which is usually the bothersome area that runs under the bra line. And if we can just take the fat deposit out of this, and it looks like a little banana roll that starts from the center going laterally or going to the side. If we can just flatten that area, she'll be very happy and very satisfied. So we define that area by lines, make sure that this is the area that exactly we want to get out. And this is the side that looks bigger than this side. And that usually happens after abdominoplasty. We sometimes see that the hips on one side is uneven with the other side. So what we want to do now this time is to flatten this a little more than the other side so it will be even. And that will be taken care of when we do our vaser and the liposuction with the power-assisted liposuction. So these are the process of drawing, and the next step would be the injection or the local anesthesia. All right. Am I correct that this is bigger than this?
Yes, the right side.
The waist. Pardon me? The waist.
The waist.
Yeah.
Like an artist.
I just need to make sure that this does not come off from the... This marker does not portray very well. Now the liposculpture is a little different in the sense it's not just simply taking the fat out of an area. The liposculpture is to try actually to accentuate your normal lines that you used to have. So if you used to be skinny from the waist and you don't see that fat there, liposculpture is to try to accentuate that line coming back again. So we try actually to make your waist smaller and draw that line line that goes from the waist all the way to your hips, that's the natural lines that you're created with, or you're naturally as a woman have got it. We try to make sure that you get that back. So the operator or the doctor will have to make sure when we do the liposuction, the liposculpture is really to accentuate the natural lines, make them show more, make them appear more. And that's what we're going to do on you. We're going to try to do liposculpture on your waistline, on your abs line as well. So that's what we're going to try today, and hopefully you'll be happy with it.
Okay, thank
Okay,
you very
deal.
much.